Early pregnancy loss is a pregnancy that ends before the 20th medical week. After the 20th week, the loss of the fetus is classified as a stillbirth or a preterm delivery. 80% of early pregnancy loss happens in the first trimester. They commonly occur around the time the woman's menstrual periods would have around the 4th, 8th, 12th, and 16th medical weeks of pregnancy. Early pregnancy loss that happen in the first few weeks of pregnancy are referred to as blighted and embryonic gestation, which means that the fertilized egg simply fails to develop for unknown reasons. Many women miscarry more than once in their life. About 1 in 36 women will have 2 early pregnancy losses due to nothing more than chance. Most often they are unpreventable and no cause is found. Having an early pregnancy loss does not affect your ability to carry a baby to term in the future. Most of the time, for no reasons other than bad luck, some chromosomal or genetic information is lost during conception. When the needed genetic information is not there at the developmental point when the fetus needs it to continue growing, the fetus dies and you will miscarry. By elimination of 95% of embryos or fertilized eggs with problems of hereditary, it is nature's way of ensuring that any issue of offspring you will have the best possibility of chances for long-term survival. Certain infections may also play a part in some early pregnancy losses. Early pregnancy losses in pregnancy often happen in the form of a heavy, late period, and if you do not know that you are pregnant, you may not even be aware that you are having one. Light bleeding and spotting is common in early pregnancy, but the longer the bleeding lasts and the more cramps you feel, the more likely it is that you are experiencing an early pregnancy loss. The bleeding associated with early pregnancy losses lasts for about 7 to 10 days. If you suspect that you are giving an early pregnancy loss, call your care provider immediately. Your practitioner will probably perform an ultrasound examination. If you have indeed miscarried, your doctor will determine if the early pregnancy loss is complete or incomplete. If you have not miscarried, your doctor may test the hormone levels in your blood and will continue to monitor you with ultrasound. Some doctors may order bed rest. If your progesterone levels are low, you may be given suppositories of progesterone to help maintain your pregnancy, although this is of no proven benefit. Incomplete early pregnancy losses, when some but not all of the pregnancy tissue is passed, are more common the longer you have been pregnant. In the case of an incomplete early pregnancy loss, your doctor may order a dilation and curettage. This procedure reduces the likelihood of infection. If you have an incomplete early pregnancy loss and are under the supervision of a midwife, you will be put under the care of her attending obstetrician for the procedure. During a dilation and curettage, you will be given general or local anesthesia, your cervix will be dilated, and any retained fetal or placental tissue will be removed. The dilation and curettage does not grow weaker your cervix or make you more likely to miscarry in subsequent pregnancies. Very rarely, a dilation and curettage can cause an infection in your uterus, which is treated by a course of antibiotics. An alternative, which many doctors are starting to use, involves the use of certain medications that trigger the uterus to start cramping and cause the remaining tissue from the pregnancy to be expelled. Thus, early pregnancy loss is so common, there are a lot of women out there who share your pain. Internet support groups can be a great resource. Some hospitals hold support groups for women who have lost their pregnancies.